Hey, Dr. Drew here, and it's today my privilege to bring Dr. Michael Warmoth here on behalf of HEAL. He is a HEAL physician. He's a pediatrician. He did his undergraduate medical school at University of Illinois and then a pediatric residency. And Michael, welcome to the program, Dr.
Thank you very much.
Should I call you Dr.
Drew?
Warmoth or
Yeah,
Michael? You call me Drew, I'll call you Michael.
Okay, that'll
Fair
work.
enough.
That sounds good.
So let's talk about breastfeeding.
Yeah.
Listen, we agree breastfeeding is what women should strive to.
Absolutely.
Right? Period. And please, la leche, keep to yourself. We are huge advocates of breastfeeding. and we could go over all the advantages. I know you all know them, and we could do that. But
Yeah.
what I want to talk about, though, is something that I think is sort of underemphasized, which is how tough it is for some women, and that they shouldn't feel ashamed, and that there are people that can help.
Absolutely. I think the key to breastfeeding is before, during, and after delivery. So finding a prenatal class that walks you through what it's going to be like, gives you some pointers. Delivering in a hospital that strongly supports it, and by strongly supporting it, I mean you have your coaches that can come in and help you there.
Are these free, or they paid
It's
for
funny,
insurance?
labor and delivery nurses are wise women and
good
men,
coaches.
great coaches, and they're more than apt to handle that.
Yeah, you don't need to specialize.
No. It's when you veer into the outpatient arena where moms feel perhaps the most nervous.
Yeah. And the most frustrated too.
Absolutely.
And then they feel like they're a failure and that they feel ashamed. Just no.
Yeah.
Ask for help.
Absolutely.
And HEAL now has some help.
Yes. HEAL, I believe, actually I know, we're going to be offering lactation consultants to come out and help you with that third aspect where,
That's a big deal.
where you leave the hospital and you don't have to feel like the world's dropped away from you.
Yeah, it's a big deal. It's a big deal. So please, if lactation, if breastfeeding is important to you, get in there, do what they say when you do the prenatal classes. Get some coaching from the labor and delivery nurses and your doctors as well.
Correct.
And then once you get home, if you have any trouble, now you've got HEAL. Call it. Get them in there.
Perfect.
All right, let's talk about benchmarks. Now, I'm sure this is a pretty complicated topic. There's all kinds of benchmarks, right?
Yeah.
Like how often should you visit a pediatrician on a routine, just from a standpoint of benchmarks?
Certainly. The pediatric schedule is sort of determined by the immunization schedule to some degree. You can expect a 2-week checkup, a 1-month checkup, a 2-month checkup, and then 4, 6, 8, 9, and 12.
Do you do that as a HEAL doctor too? Those same checkups?
Yes, we have added the capability to do all of that.
So do you come with vaccines, say, if the child needs vaccine therapies?
Yes,
Or?
they would call a few days in advance, and we could get the vaccines they need and deliver them safely to the home and administer them there.
What else are you trying to do at those benchmarks?
You know, at those benchmarks, I usually divide it into 4 things mentally. We're looking at growth, wanting to make sure the children are growing well, but part of that too is allaying fears. Children between 6 months and 18 months can start to fall down on the growth curve, or they can start to accelerate rapidly, and that just shows that they're sort of getting into the genetic part of growth. And parents, if they see their kids starting to dip, then can have a lot of concern, and it's important to say, this is what happens. You and your husband are both short. He wasn't going to stay at the 90th percentile, and this is him transitioning
Got it.
more toward a genetic type of growth. So growth is important to follow, especially in that first month when you're looking for about an ounce a day in growth. And so growth is big. Then development, making sure that your child is developing along the appropriate milestones. And then vaccines, which are crucially important to the health of the child and the community at large. And lastly, anticipatory guidance, where the 9-month-old is pulling up and you have to tell the parents, you know, have you thought about the corners of the furniture? Have you thought about the stairs and tumbling down those, and just making sure the child-proofing is all tight and taken care of.
I imagine there's advantages to seeing people in their homes.
Oh, phenomenally! Yeah, you can look around and you'll see a fireplace. You could talk about that. You'll see a stairway that doesn't have a gate on it, perhaps. And talk about
Pool
that.
in this part of the country?
Absolutely.
Southern California.
Pool, you know, that's crucial. To take the HEAL service and personalize childproofing to what you're seeing right in front of you is crucial.
Now, you did 20 years of general pediatric practice.
Correct.
And you recently joined Heal.
Yes.
What is it that attracted you to Heal?
Heal does a lot of things right. Number one, in a standard pediatric practice, there's a lot of looking in the computer, making sure you get everything in. That is getting in the way of patient interactions. We'll do that in the car after we leave the house. So we bring that back. We get to spend more time than your regular checkup in the office. And that's crucial. Parents need the time to ask the extra couple questions. I relish the opportunity to give a little more education until they're satisfied. We don't leave until they're satisfied with their child and their child's illness.
People don't trust that we're able to do it as cost effectively as we do, but the reality is we're not paying for your office, your rent, your nurses, your infrastructure that you have to maintain if you're a private practitioner. It's just you and an assistant.
Yeah,
correct. And
yeah.
Gasoline. And your malpractice.
Exactly.
That's it.
Yeah.
Yeah. So this is, I've always said there's nothing more efficient than a well-trained physician and a motivated patient or patient and family. That's it. That's the most efficient unit there is in medicine.
Yeah, that's the
Everything
integral
else-
part of the.
Everything else is an encumbrance,
Exactly.
right? Everything else, just everything else.
Exactly.
Well, Dr. Warmoth, thank you so much this has been fun.
It's definitely been a pleasure.
Great. And it's so nice to see people of quality and thoughtfulness doing primary care and finding new ways to do it, and they're efficient and really help you. So thank you so much.
Absolutely.
Thank you.